I'm Haley Kregel. My husband Dan and I had our son Bridger here at Crossing Rivers Health in September of 2019. The nurses were also friendly and made us feel so at home and just took away any anxiety or nerves that we were feeling at that time. You know, we were very excited, but yet, oh, here we go, we're going to have a baby, and, you know, we're first-time parents, so we were a little nervous, but the nurses helped us to settle in and to ease any worries that we had and answer any questions we have, and they were just very thorough, as well as including my husband, Dan, in everything that we were going through. We did end up delivering Bridger by cesarean birth. Having said that, it was the most wonderful experience that we could have had, and the care and everything was just top notch, and it was phenomenal. The whole experience and how it played out, and to see the teams come together from the OB side with the surgical teams and how the collaboration was there, they didn't miss a beat, and it was just amazing. When we got into the surgical suite, you know, they're getting me all ready for the cesarean birth, and my husband's kind of back in a room, I think, waiting until he can come in once they actually start the procedure. And he told me that there was a surgery nurse in particular, Connor, that actually took the time to go up to Dan and, you know, introduce himself, tell him who he was, just get to know him a little bit before the surgery started to make Dan feel more at ease. Tammy, the surgery nurse, she's the one that held on to me when I was getting the spinal put in for the surgery, and that just meant a lot too, to have such a caring touch during such a scary and little bit uncomfortable time. Then once they were actually working to get Bridger out and here into the world, it was just amazing to see everyone coming together and working so hard to be sure we had the best outcome. And it all happened so quickly. I think the thing that didn't seem so quick is when we were waiting to hear those first cries. It probably wasn't very long, but at that point it seems like forever. And I remember at that time Doris, the anesthetist, was behind us, and she just assured us that everything was going okay. Once we heard those cries, my husband and I were both just emotional. At that time, it's just everything. Since we had a cesarean birth, we couldn't have our own phones or cameras in there, but the team, the OB respiratory therapy surgery team, they actually have a camera that they can use in there, and they take pictures, and those pictures are so treasured by us. They just captured some really special moments. There's actually one of our son where he was just minutes after birth, and he reached up and he was gripping the stethoscope, and so we were all kind of laughing and joking, but yet serious, saying that maybe one day he'd be a doctor, or even better yet, a surgeon, you know, because of the fine ladies that helped him come into the world. My labor nurses, Rachel and Laura Kay, they were just absolutely amazing. I say they're my heroes because I don't know how I would have got through it without them, as well as the support of Dr. Blackburn and my husband. And then the postpartum care was just fabulous. The teaching from the nurses. I mean, we're first-time parents, so we're like, what are we doing? The teaching that the nurses provided was just fabulous. My husband even commented, he's like, their teaching was all so consistent. Every nurse said the same thing, you know, to reinforce the same thing. And that's what you need at that point, because otherwise it could be so very confusing when you already feel like, ooh, what am I doing here? So that meant a lot. My husband commented, and I would agree too, just one nurse after the next, they were just so nice and caring and compassionate and so good with babies. You know, Bridger would be fussing for us, and the nurse would take him, and he would just be fine. We're like, oh, you guys are magic. You could just really tell that they love babies and love what they do. One thing too that really stood out to us was, so Bridger arrived a little early, earlier than we were expecting. So Dan and I were kind of joking and telling some of the nurses that, yeah, this Friday was supposed to be our last date before the baby came, you know, our last date, just the two of us, but oh well, we're here, and we wouldn't have it any other way. Well, that Friday we were still here in the hospital. The nurses that were on that shift, Miranda and Laura Kay, they actually helped with assistance from the dietary department to give us a candlelight dinner for our last date, or first date as parents, however you would look at it. So they recreated that for us, and it was just that little thing that it just made, again, it was so emotional, but in a joyful way. It was just so nice that they took the extra steps to do that. And as an employee here myself, I've always known that Crossing Rivers Health provides exceptional care and high quality, safe care, and how much that means. But until you're actually a patient yourself, especially in a situation like this with having a baby. You don't know how much that means and the impact that that has. And so it just gives me a whole new sense of pride in what our staff here does, and then makes me in turn want to work even harder at the work that I do to provide that to someone else in the scope that I can.